my name is Shweta. Welcome to my YouTube channel, Dream Overseas Nursing, and this is my first video I'm making. I hope you all are doing well. Some of you might know me, and I know many of you don't. So, firstly, I will introduce myself. So, this will be only my introduction video, and the purpose of making this YouTube channel, that why I'm making this YouTube channel. So, just be with me. I'll introduce myself first. So, my name is Shweta, and basically, I'm from India, and in India, I'm from Himachal Pradesh, and I did my education, which is the bachelor's in nursing. I did 4 year course from Himachal Pradesh, and after that I got my first job, and it was in Gurgaon. So I had like almost 3 years of experience in Gurgaon, in India, in nursing, bedside nursing. So when I was doing nursing in Gurgaon, so at that time it came into my mind that why not to go abroad and explore my opportunities, gain more experience, or just travel around the world. Some of you might want to do that with having good amount of money, because I know nurses are very short of money in India. So this was my plan in first. So I did my IELTS and everything. If you want any tricks, any tips regarding IELTS, I can definitely share anything with you. So if you want, you can post your queries in the comment section, and I will definitely reply to every of your comments, any of your questions regarding to IELTS, because I recently did my IELTS again, and I don't think so it is that difficult. It's only the simple tricks you want to know about IELTS, and even I can share you my teachers who guided me during this whole process of IELTS, doing my IELTS, and they are like really very good teachers. So if you need any help, anything, and they are cheap as well. So you don't need to spend any like a huge amount of money, like 50,000, 15,000 rupees in India. I know it's the fees for for IELTS if you are doing the coaching for IELTS, but my tutor, I think he took like 5,000 rupees from me, and I did cleared my IELTS, and both times I cleared with him. Second time, it was not that much that I needed to go through the whole process of files, but still, you can, if you want anything, any information, I can share his ID with you. So I did my IELTS first, and then the first step, because at first, what I did, I didn't know where to go. So it was just random thing that me and one of my friend, we just went to the IELTS tuition center, and we told them, okay, we will do general IELTS. So, especially, I'm starting it from the scratch. So, you do not need for UK visas. If you want to go to UK, you do not need to give the general IELTS. You need to give IELTS UKVI, which is in academics. So please make sure you don't repeat the same mistake that me and my friend did. So after clearing your UKVI, you have to go through, there is one uh, exam that is called CBT, computer based testing. It is a simple exam with simple nursing questions, and I can guarantee that if you are, I will not even say very hardworking. If you have general knowledge about your nursing skills, you will definitely clear it. But yeah, you will need a little bit of hard work. Not very hard work, but you have to go through the question papers and everything. But I know most of them will clear it. And the third process then after that was, then I went to an agency. Fortunately, I got an agency, and they were recruiting nurses for UK. So I went through that, but then also because I had an experience in Gurgaon, I was in BMT, bone marrow transplant unit, which is specially like oncology unit. So I was not getting that many of interviews, but when I got one, I got a really like nice one with good salaries and everything. So it does matter that what your experience is. I think nowadays they are taking people who are having very less experience, maybe I think 6 months or even no experience. But it's good if you're having a little bit of experience, or a little bit of bedside skills, because it will be easy for you to work like abroad, because their system is totally different from our Indian system. Their work ethics are entirely different, and you will love to work overseas, because I did. Because in India, I was experiencing many challenges with my seniors. There is, there is a hierarchy between like seniors, super seniors, then your matrons, and the line of respect, it's very thin. Like, I know it's very thick, not thin, it's very thick, because you have to respect them, you have to stand. But the work culture, when you will go abroad, you will not find it like, you will find it very, very easy. And I know many of you will settle in very comfortably, because the seniors, they will not treat you like they are your seniors and you can't ask them anything. They are just like your friends. Even the consultants, they are just like your friends. You even when I used to work in UK, there are the times when the doctors have written the wrong prescriptions, and I know if you will do that in India with the doctors, if you will tell them to rectify their mistakes, they can shout on you. But in abroad, they will not. They are not allowed to shout on you. None of them, neither the patients nor the patients are allowed to shout on you. So you will have a really great experience working in abroad than in India. Okay, so that was my thing. I will tell you in my next videos. Please let me know what are your questions, so it will be much easier for me to make the videos, because it's my first time I'm making the videos. Because it was very hard for me to shift my career, firstly from India to UK, and then from UK to Canada was much more harder, because in Canada there are no particular specifications. So I want to let everyone know, because I just want to let everyone know that the process is very simple, but when you don't know what the next step is, it becomes very difficult. So, and I have gone through, I have wasted a lot of money, a huge amount of money that I have earned, and it's not worthy to spend this much of amount of money and then you get nothing. So follow me if you want to know more about the nursing careers in UK and Canada. For now, I can tell you UK and Canada. I have also done my registration through AFRA for the Australian nursing. So I can tell you what are the steps and how can you get registered in AFRA. But I do not. I haven't worked in Australia, so I can't tell you what is the process. And other than that, in my YouTube channel, you can get simple, if you want to know about simple tips and tricks to pass your NCLEX exam. Because when I came into, like, I planned to come into to Canada. I planned to come to Canada, sorry. And I was thinking that, okay, let's start the process. Now, how to start the process? It was very difficult for me. So, first step, somebody told me that it is NNAS. Okay, you do your NNAS, and after that, you will get your NCLEX, and then you can do a job. So, I did the same. I did my NNAS. I know many of these companies, I can say, they charge fees for NNAs. But I can tell you, I have spent a lot of money in NNAs application. I told someone to fill my application, and it was around, I think, Canadian dollar charge, which I do not say that you should go through that. You can fill your own application by yourself. It's nothing much harder. It's nothing. And if you need, I'm again saying, if you need help, you can let me know. I can help you. But it is very easy, and you should do it by yourself. So first step was NNS, okay? And then what happened? Okay, I did my NNS. I did it when I was in UK, back in UK, because I knew that somebody told me that it might take 6 months or 1 year as well. So I did it. It didn't take that much time, not 6 months. I will say 3 months, because, but it depends upon your in your home country, but your registration council. My registration council, they took a lot of time, because in India they usually take a lot of time, because they do not have those sufficient knowledge how to do it, and not even the resources, I will say. So it was a little bit difficult. So it depends upon your area. So if your nursing regulation is good, it will happen. I will say minimum even 1 month or 2 months your NNS will be completed. So I did my NNS, and after that, my second step was to do my NCLEX exam. So now the Canadian government, they have changed the rules, so they are taking the NCLEX even if you are registered with AFRA, and that is the reason I got registered with Australian Nursing. So if you get registered with AFRA, if you get registered with the, I think there is some registration council for US as well, and then the Canadian. So in Canadian, there are many regulatory bodies for different provinces, so like Ontario, Nova Scotia, and everything. So, and even so in Canada, I will tell you. So in Canada, there are many regulatory bodies for nursing. Okay. So, and each of them are having different criterias if you want to get registered as a nurse in Canada. So, uh, like take for example CNO, College Nursing of Ontario. They have a different criteria, totally different criteria than Nova Scotia, and Nova Scotia will have the totally different this criteria than Alberta or any other province. So it is very different. So make sure if you want to go move to Canada, first decide which province you want to go. And when I'm talking about provinces, I for my PR process, it took a lot of time. But I can tell you it, even from India, if you're sitting in India, you haven't done your NNS, you haven't started your anything regarding nurses, still you can get Canadian residency. And it can happen in a short duration of time. Maximum take it as 6 months, which I don't think that it is too much of time, because you're sitting in India and then you are able to get, you are sitting in India, you can work in India, and straightforward you will get your PR in Canada. So, and after you land in Canada, you can get your jobs in Canada. There are many jobs in Canada. So, especially in nursing home, and which is very easy to work with, because hospitals can be a little bit difficult for nurses because of the work overload and everything. But I don't think so. The nursing homes are that much difficult, and the salary wages are very good. So that was my all over thing. So I just want to tell you guys that what I want to cover in all these in my YouTube channel. So I want to cover everything regarding how you will get Canadian PR through nursing, and in a very like limited or less expenses, like very short expenses. Because when you come to Canada, if you are doing a study, it will cost you a fortune. It will be like, I can say in Indian rupees, for 20 to 30 lakh rupees. But if you take my advice, you can get all this PR process maximum in I will say six or not six, maybe 15 or 16 lakhs. 15 or 16 lakhs, and that too 15 or 16 lakhs, you just have to save some amount of money in which you can show. Yeah, so that is your proof of funds. So proof of funds are the funds which you have to save. You have to show them during the border area that you have this amount of money to survive in Canada for 4 to 5 months till the time you get your job. So the expense I'm telling you, it's for your PR process. If you're getting PR from any province, the application fee will be like 1,500. I will suggest not to go through lawyers, because I lost a lot of money with lawyers. But if you want to go through lawyers, although, then it will be like, take it like as like $4,000 from lawyers. Okay, so 1,500 your province application, 4,000 or 3,000, 3,000 or 4,000 Canadian dollars for the lawyer. And then again 1,500 for your final PR application, and take it like 1,000 or five, yeah, 800 or 700, 700 or $800 for your police clarification, clearance and everything, your medical, your biometrics. Oh, sorry, biometrics are involved in that, in those 1,500. So it's very less amount of money as comparison when you're paying like 40,000. If you just have to save like 15, save 15 lakh Indian rupees, out of 15 lakh, those 13 lakhs, 13 lakhs will be your money, your own money. That is your saving. They are not taking it away anyway. Okay. So only I think 3 lakhs, 3 or 4 lakhs will be your much more like your other expense for the Canadian PR. So yeah, this is these are the things I will explain in my future videos in this YouTube channel. I can tell you the pathways, how you can get registered, how you can get the nursing license in Canada, because I got it. And you can get it in like very short time span, because there are some provinces like Nova Scotia, they have seven countries they have listed. And for them to get a nursing license, in Nova Scotia is very easy. CNO, the process is also easy for CNO, but they need a work permit. If you want to work as a RN in Canada, you need a work permit first. You will get a license, although, but they will not allow you to practice until you get a work permit or you get a PR. Okay, so be careful with this. If you want to work in Ontario, first get a PR or something, or like start your process along with your this NNS process. And the second thing, the third thing I can tell you in this, this will be the how you can get hired in UK. What are the hospitals? Because this is another story I can tell you guys. Like when I got my like when I got my job in UK, me and my friends, there was a whole batch. Okay, batch was like 13, 14 people, and I was the one who was getting highest paid. My salary was like more than double than those, because all of them, they got interviewed by NHS, but I got interviewed in a private hospital. I can tell you how you will get. I know in India you think that it's that government job, the NHS job. NHS is basically government. So you think that NHS job is the government job is very necessary, it's very precious, but it doesn't happen in abroad, not at all. So, according to me, like, just clear your mind. You can work in a private sector, and you must work in a private sector because their salaries are too much higher than the NHS workers. Take it around my salary in my private hospital was around $3,000, £3,000 in UK. And on the same at the same like with the same experience, my friend who was working in NHS, she was getting like 2,100 or 2,200 on the normal weekdays. So, and plus you have to work very less. It's only 37.5 hours in a week. So only we were working like 3 days in a week, and the rest were our holidays. You can go to travel, you can do overtime shifts are also very nice. You are getting double paid and everything. If you want to earn money, you can do overtime. So it was like, I can tell you like how to get in a private sector, what was the interview, how was the interview, which are the private sectors. And you do not even go have to go to agency to get hired in the UK, because those people, when they are getting sign in bonus. So my agency from which I was hired by my hospital, they got £5,000 for getting me hired there. But if I would have applied directly to that hospital, I would have gotten those £5,000. So my sign-in bonus, they took it. So I do not want any one of you to let it go. 5,000 pounds is like 5 lakh rupees in India, so it's too much. And plus, from my hospital, it was the first thing was yeah. So my hospital was a very nice hospital, and there are many things, so many things I want to tell you because but I can't put them in one video. So you have to see my other videos, and if you have any doubts, please feel free to contact me. My email is also there if you guys want to email me. And thank you. Please subscribe my channel. Bye bye.